everyone, and welcome to the next section of our 6-part series on the eFAST exam. My name is Krista, and today we will be covering the left upper quadrant view. This slide reviews the 6 components of the eFAST exam. We'll be covering the left upper quadrant view, also known as the parasplenic view. In the left upper quadrant view, we are examining the splenorenal recess for free fluid. The splenorenal recess is the place between the left kidney and the spleen. This view also checks for fluid below the diaphragm. In the cartoon on top, you can see that the spleen is more superficial than the kidney. In the ultrasound machine on the bottom, you can see that the spleen has a homogeneous appearance, similar to that of the liver, although it has less visible vasculature, which is seen as anechoic lines running through this homogeneous gray in the liver view. The left kidney is deep to the spleen. The kidney is isoechoic to the spleen, with a central hyperechoic region that represents the inner portion or medulla of the kidney. Along the walls of both organs, there is a thin hyperechoic line representing the pleura surrounding each. Deep to the spleen and kidney, there is a thicker hyperechoic line that is the diaphragm, and deep to the diaphragm is lung space. This image demonstrates the surface anatomy that you will use to determine proper probe placement. The spleen is located in the left upper quadrant of the abdomen. It is anterior and superior to the left kidney, just as the liver is to the right kidney. However, the spleen is much smaller than the liver, and the left kidney is more superior than the right kidney. So these organs are more obscured by the rib cage on ultrasound exam, which makes it harder since we have to battle against rib shadows when trying to locate these organs. So for this exam, you'll start with the probe between the 9th and 10th intercostal space at the mid-axillary line, with the probe indicator pointed towards the patient's head. You'll probably have to slide the probe down towards the bed, often until your hand is touching the bed. The kidney is very posterior. Then you will fan anteriorly until you are able to visualize the organs. You may have to slide up or down a rib space and tilt and fan until you are able to find a good window to view the splenorenal interface. Here you can see the spleen and the kidney identified in the ultrasound image. And we are looking for fluid in this small space between them, but this is a normal exam, so there's no free fluid present in this image. This image is a sagittal cut used to demonstrate the position of the left kidney and spleen. The picture is reversed, just like a CT scan, so imagine we are looking from the patient's feet towards their head. Their left will be your right. Circled in orange, we can identify the left kidney. Note its proximity to the vertebra. Lateral to the kidney is the spleen, circled in green. These organs are very posterior, which you must consider when placing your ultrasound probe. You'll probably want to start in the mid-axillary line and then slide down towards the patient's bed and fan anteriorly and posteriorly until you are able to find the kidney and spleen. If you are too far anterior, air in the stomach will cause the ultrasound waves to scatter and obscure your image. Finally, here is the area where fluid could potentially accumulate in the setting of a trauma, which could cause a splenic laceration, which causes a lot of bleeding into the peritoneal cavity, and it would accumulate in the splenorenal recess. These are ultrasound images of both the right upper quadrant and left upper quadrant so that we can compare them. In the right upper quadrant, you'll be looking for Morrison's pouch, which is the space between the kidney and the liver. In the left upper quadrant, you'll be looking for the splenorenal pouch, which is analogous to the Morrison's pouch, but looking between the spleen and the kidney instead of the liver. You can see in these ultrasound images that the spleen and liver are both superficial to the kidneys, so they appear superior on the ultrasound images since they are closer to the probe. Note the similarity in texture of the spleen and liver. You might notice, however, that the liver has these anechoic lines running through it, and these represent the large blood vessels that run through the liver. The spleen has blood vessels as well, but they're much smaller than those in the liver, so they're harder to see on ultrasound. You can use this distinction to help you differentiate between these two views when looking at ultrasound images. You might also notice that the liver is much larger than the spleen, which makes it easier to find on an ultrasound exam. And you can see that the liver takes up most of the screen in the right upper quadrant view. And in the left upper quadrant view, the spleen is approximately the same size as the kidney. So that can make it much harder to find, especially when hidden by all of the rib shadows. And finally, in both images, you can see the similar appearance of both kidneys. They both have this kind of oval wedge shape, and they are approximately isoechoic or maybe a little hypoechoic to the liver and spleen. And they have this central hyperechoic region that represents the medulla of the kidneys. In this video, you will see a positive FAST exam for the left upper quadrant. Here we see that the kidney takes up most of the ultrasound view, and you can identify this as the kidney by its bean shape as well as its irregular borders. It is also isoechoic, and it has this central hyperechoic region that represents the medulla. And you can sort of see where the two poles of the kidney are coming together to form the hilum. And the hilum is the region where blood vessels enter and leave the kidney. And since the blood vessels are fluid filled, that's why this region appears anechoic in the kidney. So surrounding the kidney, you can see that there is this little wedge of anechoic fluid entering where the spleen should be, and separating the kidney from the spleen and from the diaphragm. So this is a positive FAST exam, and remember that fluid is dark on ultrasound. Here we have a grossly positive FAST exam for the left upper quadrant. So you can identify the spleen in this video as this kind of homogeneous isoechoic structure. You can even see the blood vessels entering and exiting it, but you don't see the kidney sitting right up next to it like you usually would, nor do you see the diaphragm. And you are also seeing this very large anechoic collection surrounding the spleen, and kind of separating it out away from the diaphragm and the other organs in that area. So all of this anechoic stuff in here is free fluid. So this is a positive FAST exam indicating that the patient has free fluid in their abdomen. And that is all I have for you today in this video on the left upper quadrant view of the eFAST exam. To summarize, here's what you learned today. How to understand the anatomy of the left kidney in relation to the spleen, diaphragm, and rib cage. You learned how to identify the left kidney, spleen, and diaphragm on a FAST exam, as well as how to identify free fluid. You also learned to recognize a positive FAST exam, particularly for the left upper quadrant. And that is all I have. Thank you for tuning in to this video in our 6-part series of the eFAST ultrasound exam. If you have any questions, you can contact any one of us